Okay, let's unpack this. Have you ever started a new medication and suddenly felt a little well off? Maybe the room does a subtle wobble, or you get that, fleeting lightheadedness.
Yeah, that feeling.
It happens to so many of us, and today on the deep dive, we're really laser focused on understanding why medication can cause dizziness.
Right. And more importantly, what you can actually do about it.
Exactly. What are the practical steps you can take?
So we're diving deep into this whole medication-induced dizziness thing.
Yeah.
Looking at the various triggers, how long this sensation might actually last.
The strategies, right?
Some really effective strategies you can use to manage it, yeah.
Okay. So for this session, we've brought together information from a pretty comprehensive article looking at medication side effects,
Right.
and also a really compelling scientific study that analyzed reported cases of drug-related vertigo and dizziness.
Right.
Our goal today is, well, pretty straightforward. We want to equip you, the listener, with a clear understanding of this sometimes unsettling side effect.
And give you those actionable solutions based on expert knowledge and, real-world insights.
Yeah, and we get that when you're feeling unsteady, you just want clear, helpful information.
Absolutely. Without getting bogged down in super complex medical jargon.
Right, we're here to give you exactly the essential stuff you need, presented in a way that's hopefully easy to grasp.
And look, if this deep dive really sparks your interest and you want to explore this topic even further,
Which you might.
we definitely recommend Dr. Benny Danglad's book. It's called Dizziness from Medication: Why It Happens, How Long It Lasts, and What You Can Do About It.
Great title. And it's available as both an ebook and in paperback. We'll make sure there's a direct link for you right in the description below.
Definitely check that out for more detail.
Okay, so let's get right to it. What are the main ways a new medication can make us feel, well, dizzy?
Well, one of the main ways, as the article points out, is through lowering blood pressure.
Ah, okay.
This is especially common with meds prescribed for heart conditions or, high blood pressure, right? Think about it if your blood pressure dips too much, particularly when you stand up.
Yeah,
That can lead to that familiar lightheaded feeling.
right, okay. It's like that head rush when you stand up too quick,
Yeah.
but triggered by the medicine. So heart meds are often the ones.
Often, yeah, but not always. Another key factor is inner ear disturbances.
In ear, okay.
Yeah, certain medications can actually affect those delicate mechanisms inside your inner ear.
Which control balance.
Exactly, which is crucial for maintaining balance. And this can result in vertigo, that really distinct and often quite bothersome sensation of spinning.
Oh yeah, that spinning sensation. That sounds incredibly disruptive.
It really can be.
What other ways can medications kind of throw off our equilibrium?
So the article also highlights central nervous system effects.
Okay, the brain itself.
Right. Medications that work on the brain, think things like some antidepressants, anti-anxiety drugs, even sedatives. They can sometimes impair our coordination and overall balance. So that leads to a general feeling of dizziness or maybe just unsteadiness. It's not always a direct hit on the balance organs themselves,
So it's more about how the brain is processing those balance signals. That's interesting.
Exactly. And we shouldn't forget about dehydration. That's another one.
Dehydration, how does that connect?
Well, some medications act as diuretics. They basically make your body lose more fluid.
Ah, right.
And dehydration, as we probably all know, is a common cause of dizziness just on its own.
Okay, wow. So several different potential pathways there. It really does underscore the importance of paying attention to when you first notice that dizziness,
Absolutely.
especially if it lines up with starting a new medication.
Timing is key. And the PubMed study we looked at, it really backs this up. They analyzed a huge number of reports of adverse drug reactions and found that vertigo or dizziness were frequently reported alongside several classes of drugs. We're talking anticonvulsants, antihypertensives, antibiotics, antidepressants, antipsychotics, even anti-inflammatory drugs. It's quite a broad range.
Wow, it really highlights how widespread this potential side effect can be across so many different types of common medications.
And what's quite notable, their analysis of reports from just one region back in 2012, it showed that vertigo or dizziness made up about 5% of all reported adverse drug reactions.
5%?
Yeah, and the researchers even suggested that this might be an underestimation. 5% might sound kind of small, but when you think about how many people take medications,
That's a huge number of people.
it could still represent a really significant number experiencing this issue, yeah.
That's a really good point. You don't often think about the sheer volume Why might it be underreported, do you think? Maybe people just assume it's, I don't know, something else.
Exactly that. Or they just don't connect it to their new medication. Dizziness can stem from so many different things, right? So the link to the drug might not always be obvious. Plus, while it's rarely, life-threatening, as the study points out, dizziness can increase the risk of falls.
Oh, definitely. Especially in older adults.
Right. Which just reinforces why it's so important to be aware of this potential side effect.
Okay, so we've covered some of the why. Now, what about the how long? If you start feeling dizzy from a medication, how long might you expect that to last?
Yeah, good question. The article gives us a pretty good sense of the factors involved here.
Yeah.
The type of medication itself is a key one.
Great.
Some meds might cause just temporary dizziness as your body kind of adapts, and this could resolve in maybe a few days.
That's not too bad.
But others, especially those that have a longer half-life.
Half-life meaning how long it stays in your system.
Exactly, how long it takes for half the drug to be eliminated. Those can cause dizziness that lasts for several weeks.
Weeks, wow. That could be really, really disruptive to someone's daily life.
It certainly can be. And another factor, perhaps obviously, is the dosage.
Higher dose, more effect.
Generally speaking, yeah. Higher doses are more likely to cause more significant and potentially longer-lasting side effects. And that includes dizziness.
That makes intuitive sense.
Yeah.
A stronger effect might just take longer for the body to adjust to.
Precisely. And then, of course, you have individual factors.
Like what?
Well, your age, your overall health status, any other medications you might be taking. These can all influence how long the dizziness sticks around.
So someone older, or maybe with other health issues, might experience it for longer.
That's often the case, yeah. It's a very individual experience, it sounds like.
It really does.
And the article also reminds us about withdrawal effects. This is important.
Dizziness when stopping a med.
Exactly. It can sometimes happen when you stop taking certain medications, particularly some types of antidepressants and anti-anxiety drugs.
Okay.
And this is why it's so crucial to never just stop these types of medications abruptly without talking to your doctor first.
That's such an important warning. Never just stop on your own. And it brings to mind that quote from Landon Smith that the article includes. Something like, the only person who can tell you what a reasonable dose of medicine is you.
Yeah, I like that quote. It really emphasizes being tuned in to your own body, doesn't it?
It really does. And the need for that open communication with your doctor or pharmacist about any side effects you're experiencing.
Absolutely. And the article rightly advises, if dizziness persists for more than a few days, or if it's really impacting your daily life significantly.
Get it checked out.
Seeking medical advice is essential. Don't just try to push through it indefinitely.
Okay, so let's say you are hit with that dizzy feeling right after taking a medication. What are the immediate things someone should do? Like right then and there?
Okay, immediate steps. The article provides some very clear, very practical advice. First and foremost, sit or lie down straight away.
Safety first.
Absolutely. That's the most important thing to prevent falls, prevent potential injury if you actually lose your balance.
Makes sense. What else?
Next, hydrate. Drink plenty of water. As we mentioned, dehydration can be a factor.
Right, it can contribute.
So replenishing fluids can often help quite a bit.
Simple, hopefully effective.
Then avoid sudden movements. Get up slowly from sitting or lying down. Be mindful of changing positions too quickly.
Give your body time to adjust.
Exactly. Give your body and your blood pressure time to catch up. Rest is also key. Just give your body a chance to adjust to the medication. Don't try to power through.
Basically, listen what your body is telling you. Don't push it.
You got it. The article also suggests checking your blood pressure if you can. If you happen to have a monitor at home.
Why is that helpful?
Well, a significant drop in blood pressure could be contributing to the dizziness, so knowing that number can be useful information.
Good point.
And finally, and this is so important, consult your doctor if the dizziness is severe or if it just doesn't go away after a little while. They absolutely need to know what's happening.
Okay, those are the immediate actions. Good practical tips. But what about dealing with this sort of ongoing dizziness if it persists? What are some effective management strategies for the longer term?
Right, the longer game. The article offers several crucial strategies here. The first, and maybe the most vital one, is to communicate openly and honestly with your doctor.
Always comes back to that, doesn't it?
It really does. They're the best person to figure out if the medication is truly the culprit.
Right.
And to explore potential alternatives or maybe dosage adjustments.
Yeah, you can't find a solution if your doctor doesn't even know there's a problem.
Precisely. And a related step is to review all your medications with your doctor or pharmacist.
All of them?
Yes. That includes not just your prescriptions, but also any over-the-counter drugs, supplements, herbal remedies you might be taking.
Ah, good point. It's easy to forget those things that aren't prescribed.
Yeah, but they can definitely interact or contribute to dizziness sometimes.
Okay, so full disclosure is key.
Absolutely. Then, based on that review, your doctor might recommend adjusting the dosage of the medication causing the issue. Sometimes just a slightly lower dose can be just as effective treatment-wise, but with fewer side effects.
Worth a try.
Definitely. In other cases, it might be necessary to actually switch medications altogether. Find a different drug that treats the same condition, but maybe has a better side effect profile for you personally.
So it sounds like it can be a bit of a process, finding the right balance.
It really can be. Patience is often needed. Also important is managing any underlying health conditions you might have.
How does that help with medication dizziness?
Well, if you have conditions like high blood pressure or diabetes, for example, keeping those well controlled can sometimes help reduce medication-related dizziness indirectly.
Interesting. So better overall health helps.
It often does. And finally, for dizziness that's specifically related to those inner ear issues we talked about, your doctor might suggest something called vestibular rehabilitation therapy.
Vestibular rehab? What's that?
It involves specific exercises designed to help improve your balance system. Think of it like physical therapy, but specifically for your balance.
That's fascinating, like retraining your balance system.
Exactly. So that covers some of the management strategies. Now, what about things someone can do in their daily life? Just practical tips to help manage or maybe even stop this dizziness from medication.
Yeah, what can you do yourself?
Okay, the article emphasizes several lifestyle adjustments. Number 1, staying well hydrated. We keep coming back to this, but dehydration really can worsen dizziness.
Drink that water.
Drink that water. Eating regular meals is also important. This helps keep your blood sugar levels stable.
Low blood sugar can cause dizziness too, right?
It sure can. So avoiding those big dips by eating regularly can have a positive knock-on effect.
Okay, stable blood sugar. Good tip.
Also, limiting caffeine and alcohol is generally advisable. These substances can exacerbate dizziness in some people.
Make things worse.
Potentially, yeah. And getting sufficient sleep is crucial. Fatigue can make dizziness feel much, much worse.
Makes sense. Everything feels harder when you're tired, especially balancing.
Right. And finally, practicing relaxation techniques, things like deep breathing, meditation, maybe some gentle yoga.
How does that help?
Well, stress and anxiety can sometimes contribute to or worsen dizziness, so managing stress can be beneficial.
Okay, so it really sounds like a holistic approach can be the most effective, taking care of the whole body.
That's a great way to put it.
Are there any specific remedies that might offer more immediate relief when you're actually feeling dizzy? Anything you can take.
The article does mention a few possibilities, but with cautions. Ginger is one. It's known to help alleviate nausea and sometimes dizziness.
How would you take that?
You could try it in forms like ginger tea or ginger candies, even capsules. Some people find it helpful.
Okay.
Some individuals also find relief through acupuncture. That's another avenue some explore.
Interesting.
And then there are over-the-counter antihistamines like meclizine or dimenhydrinate. Dramamine is a common brand name. These can help with dizziness and nausea.
But there's a catch.
Big catch. Use these cautiously. They can cause significant drowsiness.
Right. Definitely something to be careful with, especially if you're already feeling unsteady or need to drive or operate machinery.
Absolutely. Always read the labels and maybe talk to your pharmacist first.
Good advice. Now, what about the flip side? When the dizziness is actually from stopping a medication, that withdrawal dizziness we touched on earlier, how is that managed differently?
Yeah, withdrawal dizziness. The absolutely crucial point here, as the article stresses repeatedly, is never stop taking a medication abruptly, especially things like antidepressants or anti-anxiety meds, without consulting your doctor.
Don't just quit cold turkey.
Definitely not. A gradual tapering off of the medication, guided by your doctor, is usually the way to go to minimize withdrawal symptoms, including dizziness.
Okay, so tapering is key.
It's essential. Beyond that, the general advice is quite similar to managing ongoing dizziness. Stay hydrated, get enough rest, manage stress.
The basics still apply.
They do. And again, if the withdrawal symptoms are severe, it's vital to consult your doctor. They might need to adjust the tapering schedule, make it even slower, or perhaps even prescribe other temporary medications to help ease the symptoms.
So slow and steady with medical guidance is definitely the best way to go when stopping certain medications.
Absolutely.
Now, the big question I think that's on everyone's mind when they experience this, will this dizziness eventually go away? Is it permanent?
That's the million-dollar question, isn't it? In many, perhaps most cases, the answer is yes, the dizziness will subside.
That's reassuring.
It often gets better as your body adjusts to the medication over time, or certainly after the medication is stopped or switched, if that's the necessary course.
Okay.
However, as we've emphasized throughout, it's really essential to work closely with your doctor. They need to help manage the symptoms and address any underlying causes that might be contributing. It's not always just the medication.
Right, rule out other things too. But it's good to know it's often temporary. The article also touches briefly on the role of diet and nutrition beyond just regular meals. How can what we eat influence this?
Yeah, proper nutrition can certainly play a supportive role, nothing magic but foundational. The article recommends just eating a generally balanced diet. Plenty of fruits, vegetables, whole grains, lean protein, the usual good stuff.
Makes sense.
If someone happens to be anemic, which can cause dizziness itself, then incorporating iron-rich foods is important. Think red meat, beans, spinach.
Okay.
And similarly, for those who might have a vitamin B12 deficiency, which can also contribute to neurological symptoms like dizziness, including foods rich in B12 is helpful. So meat, fish, dairy products, fortified cereals.
So basically, maintaining overall good health through diet can help your body better handle medication side effects in general.
Exactly. It builds resilience. And, it's also really important to acknowledge the mental and emotional impact of dealing with chronic or recurring dizziness.
Oh, absolutely. It can be quite unsettling, can it? Feeling constantly off balance.
It really can. It can sometimes lead to feelings of anxiety, maybe even depression, especially if it interferes with daily life.
I can imagine. Feeling unsteady can definitely take a toll on your mental well-being.
For sure. So the article suggests seeking support if you're struggling emotionally. Talking to a therapist or a counselor can be really helpful.
Getting professional help.
Yeah. Or even connecting with others in a support group, people who actually understand what you're going through firsthand. That can provide valuable emotional backup.
Shared experience.
Exactly. And of course, just generally engaging in self-care activities that promote relaxation and well-being is always important when you're dealing with any chronic symptom.
Taking care of your mental health is just as important as your physical health in this situation. Maybe even more so sometimes.
Couldn't agree more. Now, the article wraps up with some frequently asked questions, which is always a useful format. Shall we touch on a few of those?
Yeah, let's do a quick round. Can over-the-counter medications cause dizziness? We mentioned antihistamines, but anything else?
Yes, they definitely can. Besides antihistamines, some decongestants can also be culprits. Even some pain relievers or sleep aids might list dizziness as a side effect. Always check the label.
Good reminder. When should someone definitely seek medical attention for dizziness from medication? Like, what are the red flags?
Okay, red flags. If the dizziness is severe, meaning it's really intense or debilitating, if it's persistent, meaning it doesn't go away after a few days or keeps coming back strongly, or importantly, if it's accompanied by other concerning symptoms.
Such as?
Things like a severe headache, especially if it's sudden or different from usual, blurred vision, chest pain, shortness of breath, numbness or weakness, difficulty speaking, those warrant immediate medical attention.
Okay, don't ignore those associated symptoms. Now the scary one. Can dizziness from medication ever be permanent?
It's rare, thankfully. But in some specific instances, particularly if a medication causes actual damage to the structures of the inner ear or parts of the brain involved in balance, it could potentially be long-lasting or even permanent. This really underscores the importance of discussing any persistent dizziness with your doctor sooner rather than later.
Right, catch potential issues early. How can you try to prevent dizziness from medication in the first place? Any proactive steps?
Well, prevention is tricky because you don't always know how you'll react. But the best approaches are, number one, having those open conversations with your doctor before starting any new medication. Ask about common side effects like dizziness.
Forewarned is forearmed.
Exactly. Number two, doctors often start with the lowest effective dose and only increase it if needed. This minimizes the initial impact. And number three, as we've said, staying well hydrated can sometimes help mitigate side effects.
Okay, communicate, start low, stay hydrated. Got it. And finally, is dizziness from medication always a sign of a serious underlying problem?
Not necessarily, no. Often it's just a temporary and relatively minor side effect as your body adjusts. However, it can sometimes indicate something more serious, like an allergic reaction, a significant drug interaction, or perhaps the medication is unmasking another underlying issue.
So don't dismiss it entirely.
Right. It's always wise to discuss it with your doctor, especially if it's a new symptom for you, or if it seems to be getting worse rather than better. Better safe than sorry.
That is all incredibly valuable information, and it just consistently comes back to the absolute importance of that open dialogue with your healthcare provider, doesn't it?
It really does. Communication is key.
And just to bring in another perspective quickly, Chloe MacArthur, who's a senior cardiac nurse at the British Heart Foundation, she also highlights that, yes, occasional dizziness can just be part of living with a heart condition itself.
Right, not always the meds.
But it's also a known side effect of many medications used to lower blood pressure or heart rate.
Yeah.
And her advice really strongly aligns with everything we've just discussed.
What does she emphasize?
She advises allowing your body time to adjust to a new medication, usually giving it maybe 2 or 3 weeks, making sure you're eating and drinking adequately, but always discussing any specific fluid restrictions with your doctor first, especially with heart conditions.
Good point.
Standing up slowly, we covered that, and absolutely discussing any persistent or worsening dizziness with your doctor so they can review your medications. It's the same core message.
Yeah, that really reinforces the importance of patience, good self-care habits, and that proactive communication in navigating this very common side effect.
So if we boil it all down, the key takeaway here really is that medication-induced dizziness is, well, a pretty common experience.
Very common.
It has a variety of underlying causes, many of which are often manageable. But that clear and open communication with your doctor or pharmacist is absolutely essential.
Paramount. To understand why it might be happening to you and what you can do about it.
And please, if you are experiencing dizziness that is severe or that just doesn't seem to go away, please do seek professional medical advice. Don't just guess.
Absolutely. And maybe it's worth taking just a moment now to consider your own experiences.
Yeah.
Have you ever felt that sensation, that feeling of being off balance when starting a new medication?
Yeah, do any of the points we've discussed today kind of resonate with you or something you've gone through?
It's useful to reflect.
And if you do want to delve into this topic in even greater detail, maybe get more specific practical strategies, don't forget about Dr. Benny Danglad's comprehensive book,
Great resource.
Dizziness from Medication: Why It Happens, How Long It Lasts, and What You Can Do About It. As we said, you'll find a direct link to both the ebook and the paperback versions right there in the description below. Makes it super easy for you to explore this further if you need to.
Yeah, it's a fantastic resource. Offers even more in-depth insights and real practical guidance. Highly recommend checking it out if this is relevant to you.
Definitely. Okay, so finally, a thought to leave you with as we wrap up. As medications become, an increasingly integral part of healthcare for so many of us.
They really are. How can we become even more empowered, more proactive in partnering with our doctors to minimize these unwanted side effects and truly prioritize our overall well-being, not just treating the condition?
That's a great question to ponder. How do we navigate that balance?